Of the Nairobi Women's Hospital. It has exposed how private hospitals are exploiting the sick and the scared for profit. Now, the Association of Kenya Insurers says it has the numbers to corroborate the avalanche of responses, that particular post that was made by Maurice K, more popularly known as Owa, on Twitter. And the Kenya Medical Practitioners and Dentists Council says it has launched formal investigations. Here's that report.
Mimi mwenyewe mpaka wa leo sina amani nikifikiria huu unyama ambao nimetendewa na hii hospitali. Management ya Nairobi Women Hospital Adams, tafadhali ninawaomba kwa niaba ya wale watu wote ambao wanateseka kwa kulipa bills katika hiyo hospitali yenu, mkuwe na utu. Mnaweza kaa mreview the situations that you have put these people whom you have been caring for their patients. May you review your loss.
As Kenyans took to social media on Tuesday and Wednesday to castigate private hospitals that put their commercial interests ahead of patient care, for widower Nabatwa Kisa, it was like pouring salt into a wound. In July of last year, he experienced firsthand the lack of empathy exposed in leaked WhatsApp group chats of Nairobi Women's Hospital administrators. The administrators conspired to limit discharges in order to pad their bottom line.
Akiwa pale alikaa siku 3, hata nikaanza kuwauliza kama ni meningitis mnatibu. Meningitis huchukua muda gani? Wakaniambia ni 48 hours. Nikamwambia basi sio meningitis juu tumepita hizo 48 hours zenye ninajua. Wakaniambia ninawasumbua niende nyumbani.
He complied. It was while he was there that he was informed of his wife's demise. His bill, 1.3 million shillings. And for 1.5 months, he was unable to lay his wife to rest. The hospital turning a deaf ear to the driver's desperate offer of collateral and an installments plan. That is, until he alerted the media to his plight.
Hadi wa leo, hii hospitali wamenifrustrate sana. Maana kila mara huwa wananipigia simu wakiniambia hii pesa unalipa kwa mwezi ni kidogo sana. Lazima ujaribu kando na hii 10,000 utafute pesa ingine umalize hii deni mapema juu ulipoweka title deed utapoteza hii shamba.
Even the discharge process. You look at the discharge process. At times it is so slow and cumbersome. Either the doctor is not there. One of the hospitals even signing the discharges.
And if a study carried out by the Association of Kenya Insurers is anything to go by, the agony Wakisa went through trying to feed the money-hungry monster that is the private hospital system is not isolated.
As medical underwriters, we had a feeling that some of the patients were being unnecessarily detained for reasons of probably sustaining bed occupancy. Yeah, and that's what prompted us to do the study. And we also found out the cost, average cost per patient, and what that we have all that data here. Okay. But I think for this purpose, we can leave it at such.
Okay.
Yes.
So after carrying out the study, did you find that your fears were unfounded or founded?
They were founded.
The cat out of the bag, the Kenya Medical Practitioners and Dentists Council is taking a closer look at the hospital's discharge practices.
People are saying they have been told, please go out and get more patients, detain this particular patient. That is something that we need to go and investigate. Actually, as soon as the hospital responds, whether they hear this or not, as soon as the hospital responds, I'm double sure the council will make a decision of visiting and evaluating beginning a particular period.
But the problem, Aki says, is bigger than Nairobi Women's Hospital. As the government strives towards affordable, accessible healthcare for all, the private hospitals continue to raise the stakes.
In late last year, there were circulars to insurance companies informing them that come this year, there will be increase in all services. When we ask, because medical is normally done on accommodation, how do we manage this? They say that you cannot, if you can't get the correct premium from the insureds, you should not holders at that point because you cannot get enough premiums.
Hospitali siku hizi zinanyanyasa wagonjwa sana. Na kila mwananchi ukipeleka mgonjwa wako hospitali lazima ukuwe makini sana. Na ni vile nimekosa tu njia ya kushtaki hiyo hospitali juu. Kuwashtaki itahitaji niwe na fedha ndipo tukabiliane na wao kotini.
Olive Barrows,